on HRSA's Title VII Health Professions and Title VIII Nursing Workforce Programs. But before we begin, I want to thank Representative Richard Hanna's office for helping to reserve the room, and our HPNEC members who helped us secure this very esteemed panel for us today. HPNEC is an alliance of over 60 national organizations dedicated to advocating for continued funding for the Title VII and Title VIII programs as they train the next generation of healthcare professionals. We're particularly excited for today's briefing because 50 years ago today, President John F. Kennedy signed the very first Title VII programs into law. At the time, he called this legislation one of the most significant health measures passed by Congress. And we've actually detailed the timeline of the programs over the years in your packets in the HPNEC brochure. At the time, they were facing looming health profession shortage, and legislation established the Title VII under the Public Health Service Act for new construction, grants to health professions, schools, grants for training health professionals, and grants to fund loan programs for students in need. This landmark legislation affirmed the federal government's role in ensuring a well-prepared healthcare workforce for the American people. However, President Kennedy acknowledged this legislation was by no means solving all of the nation's healthcare workforce needs, and he intended it to serve as a foundation to build on in the future. And shortly after, President Lyndon Johnson signed legislation creating the nursing program as authorized under Title VIII of the Public Health Service Act. Since then, the health professions programs have evolved to support education and training opportunities across the health disciplines. And over time, Title VII and VIII have continued to respond to the nation's healthcare needs by recruiting and retaining aspiring health professionals to fill gaps in the workforce. The program's second phase focused on enhancing the training of the primary care and nursing professionals, as well as curriculum development. And then, following this shift, after realizing the prevalence of geographic maldistribution and health disparities, the next shift inspired a focus on care for the underserved and vulnerable populations, as well as the distribution and diversity of the health professions workforce. Today, under the leadership of HRSA, and we're lucky to have several individuals from HRSA here today, the programs continue to advance innovations in improving the supply, distribution, and diversity of the healthcare workforce. Further, with the Affordable Care Act offering millions of previously uninsured individuals access to the healthcare system, Title VII and VIII will be instrumental to preparing the workforce to care for the nation's children, seniors, underserved, and most vulnerable. Today, our esteemed panel will discuss how the programs meet their three-pronged goal of improving the supply, distribution, and diversity of the health professions, while also highlighting how the programs can advance timely health priorities. First, we'll hear from Dr. Mindy Fain, who is a distinguished member of the geriatrics community and board-certified in internal medicine, geriatric medicine, hospice, and palliative care. Dr. Fain joins us from the University of Arizona College of Medicine, which is a professor of medicine and chief in the Division of Geriatrics, Internal Medicine, and Palliative Medicine. She leads geriatric clinical and education programs at the University of Arizona Health Science Center and leads two critically important statewide grants, including a Title VII Geriatric Education Center. Next, we have Dr. Beatrice Kalish, who wrote the book on Title VIII nursing programs. Quite literally, she wrote a couple. She is the 2013-2014 Institute of Medicine Scholar in collaboration with the American Academy of Nursing, the American Nurses Association, and the American Nurses Foundation. Dr. Kalish is also the Shirley Titus Distinguished Professor of Nursing and Director of Innovation and Education at the University of Michigan School of Nursing. Throughout her career, she's conducted numerous research studies on the nursing profession and is recognized as an expert of the history of federal nursing workforce initiatives, including Title VIII. Last, we will hear from Dr. Tiffany Gruber, who is actually our very first Profile of Success in the HPNEC's Profile of Success series, where we highlight individuals who participate in the Title VII and Title VIII programs. So we're very excited she's here today. And we have her original profile. She'll obviously share her reflections and give you an update on where she is in her career today and about her participation in Title VII. Dr. Gruber is currently a National Health Service Corps Scholar and a primary care physician at Total Healthcare Inc. in Baltimore, Maryland. Dr. Gruber has been recognized for her dedication to eliminating health inequities and her commitment to primary care. She was recently awarded CDC's Excellent in Frontline Public Health Service Award, the American College of Physicians Resident Leadership Award, and Boston University Internal Medicine Residency Advocacy Award. Again, we have a very esteemed panel. We're very lucky to have them, and their full biographies are actually in your packets. So without further ado, let me turn the podium over to Dr. Fain.